YouTube, it's me again. Like I said before in my first video that I'm going to make a video about my infant loss, or HELLP Syndrome and NEC, or known as NEC. Sorry about this window behind, I'm trying to cover it up with my head, but I'll do my best. And I'm also reading off my other computer screen because I wanted to have the information for you guys about HELLP. So I'll start with HELLP Syndrome. I think one of the most frustrating things is that in the book that I was given at my first 12-week appointment, what to expect when you're expecting, there I think is literally not even a page on HELLP Syndrome. And I wish there was more. But I'll just read a little bit about HELLP Syndrome. So HELLP symptom occurs in pregnant women who have H is hemolysis, the breakdown of red blood cells, EL stands for elevated liver enzymes, and LP is low platelet count. So that's why when you go to your doctors, you pee in a cup and they stick a little stick in there. They're testing for liver enzymes that are in your urine. Let's see. So, symptoms. Only one I had. Fatigue or feeling unwell. Well, I was pregnant. I mean, I felt good. My whole pregnancy, I felt really, really good. I was a little nauseous at the beginning, but I felt good. Fluid retention and excess weight gain. No, I had no edema, no swelling, no nothing. Weight gain, normal weight gain for a pregnancy. Headaches. I did have a headache like 4 days before he was born. I'll get to that. But other than that, I never had headaches. Not even in the beginning of the pregnancy, I rarely had headaches. Nausea and vomiting that continues to get worse. Nope. Pain in the upper right part of the abdomen. Now, this is the one the doctors always kept telling me to watch for. And I never had it until the day Dylan was born. Blurry vision. Nope. Other than not wearing my glasses or my contacts. Nosebleed or other bleeding that won't stop easily. And it says rare, which I had none. Seizures or convulsions. None of those. So, I was going to look up what drugs I was on, and I don't remember what it was. So here's the story. It might be a long video, and I apologize, but I'm doing a little PSA. I looked online, especially after this whole happened, and I couldn't find anything talking about the people or the women who had gone through HELLP, only through, their preemies life and their experience, but never what the moms experienced. And I was frustrated that I couldn't find anybody that I could relate to. So I'm making this video for anybody who might have HELLP. So I have my journal, so I'm going to be looking away from the camera a lot. I have a journal or my planner of tests and everything. So I wish I remembered when my blood pressure started getting high. I want to say it was like around week 18. Usually my blood pressure was like 103/60, really low, good. Then one time we went in there, and this is when I was going in just once a month, it was 130/something, and I was like, oh my gosh, that's kind of high. And the lady, or the nurse said, oh, we were just talking about weight gain, because I had like gotten into the 130s, which I obviously have never done, but so she just associated it with me like being nervous about weight gain or something, so no big deal. But they were keeping an eye on it because I still had high blood pressure. Let's see. Everything was going good. I was going to a specialist because the baby was a little bit on the small side, and they just wanted to make sure he was growing okay. So when I was going to the specialist, he discovered that I had uterine notching, which is, as they explain it in layman's terms, is there's arteries going to your uterus, which ultimately feed your placenta. And it's almost like they said, like if you're going down a highway and it's a 2-lane highway and they close one lane and there's kind of like a clog, but then it opens back up. That's what it is. So it's just a little bit of restricted blood flow. So they were just making sure that he was getting enough oxygen and blood and nutrients, which he was. He was growing. They just wanted to make sure that he kept growing. Um, let's see. So he was watching that. So we were actually at that specialist when it was week 29 exactly, and we were sitting there and he was doing the test and he was checking all sorts of stuff just because it's at a university hospital, so they had another student there and they were showing stuff. It was like an hour-long appointment. So I've been laying there having an ultrasound, which I don't mind. I like to see ultrasounds. And so at the end of the ultrasound, I was telling the doctor that the OB had discovered that I kind of had high blood pressure. And so he's like, oh, well, let's check it. So he called a nurse in, and they never checked my blood pressure there. So they called the nurse in, and lo and behold, my blood pressure was 150 over 110. I could just tell in their face, like, they were completely freaked out. They were like, lay down, lay on your left side, like, don't move. So they go out and you can hear them in the hall talking, and they come back in and they're like, okay, we've called labor and delivery at Boulder Valley Hospital, and just go straight there. Like, you just need to get checked in and be there in case anything happens. So they wrap up the appointment, and we go to, actually, it sounded like a good idea at the time, and ultimately it didn't make a difference, but the appointment was at 10:45. It was an hour-long appointment. It was like 12 o'clock. It was lunchtime. I'm pregnant, and I was hungry. So we knew we were going to be at the hospital, so we went, grabbed a bite to eat, and then we made our way to the hospital. They admitted us. Uh, let's see. They just put monitors on the baby. The baby was doing fine, but I was also having a lot of Braxton Hicks, which I got a lot, and I drank a lot of water, and nothing really subsided them. So they were just monitoring the baby, and he was doing fine. Nothing was even affecting him. And that day, actually, I had a really, really bad headache. But I get headaches sometimes because I have previous neck injuries. And so, oh, my computer just froze. I hope it's still recording. Oh no. Anyway, so I get headaches from my neck. So I was like, oh, this headache won't go away. And I tried ibuprofen or Tylenol, excuse me. I was not taking ibuprofen. I was taking Tylenol, but it wasn't really helping. So that was the one time that I actually had one of the symptoms of headaches. So they just watched me, and ultimately they gave me some shot that I hope nobody ever has to have because it was horrible, to stop the contractions, because they were like every 3 minutes, and they did a cervical check. I wasn't dilating. Everything was closed. Everything was good. But they gave me this drug that made me feel so sick. Like I felt like I drank a gallon of coffee. I was jittery and nauseous and just felt horrible. That subsided. Um, and then they decided, my OB finally came in, and they decided to, um, because, oh, my computer's trying to do updates. Okay, sorry. Um, he decided, because I was having high blood pressure and they were having a little bit of issues, they were going to give me the steroid shots to help the baby's lungs develop. So they gave me that, and then I had to go back 24 hours after and get the second shot because it's two rounds. So everything was good. Though, oh God, they gave me. I mean, my headache was. I've had migraines. This was a horrible headache, and Tylenol was not helping. And he asked me, he's like, do you want something for your headache? And at this point, I was like, please, yes, because I am dying. So he gave me, oh shoot, a painkiller, not Vicodin, one with the P. I have not thrown up from the day I was pregnant to 29 weeks. That drug made me throw up, and it was no fun. Throwing up while 29 weeks pregnant, not good at all. Yuck. So after they gave me that, and I threw up, they prescribed me Vicodin in case my headache came back. But the Vicodin didn't help, and I think I only took one because after that it did go away. So the next day, so this was all November 10th, 2010. So November 11th, We went in, had our second shot. I was put on the baby monitor. He was doing fine. Contractions had ended, so all was well. Of course, he's, take it easy. Don't do anything strenuous. Just drink lots of water. Relax if you feel tired. Blah blah. Same thing. So they had ordered actually before that, and I can't. I think when I had my like a week before, I did a urine test just to make sure, because I think when they dipped the pee stick, it came back like a light color of green, which means that there is protein in your urine. So I did a or a urine test, 24 hours, and it came back like with trace amounts of protein in it, which is not unheard of at 29 weeks. So then on the week later, so on the 14th of November, I was supposed to wake up in the morning and take another 24-hour urine test. Woke up at 8 o'clock, and before you start the test, you're supposed to like empty your bladder, so you're starting at that time. So I went to the bathroom, laid back down. Oh gosh, five minutes passed. I was just laying there awake in bed, and I started experiencing the worst pain. Okay, so when the doctor was like, watch for upper right quadrant pain, like for your liver, like it'll be just tender, like an ache that won't go away. Oh no, this was severe. I woke up, or I was laying there, and I was like, Roger, something is wrong. I'm like, if I had to guess what a heart attack would feel like, I'm having it. It was hard for me to breathe, like my back hurt, like it was not just in my upper right, like underneath my rib where my liver is. It was like I couldn't even catch my breath, like it just like aches, like everything. I don't know. I didn't think it was HELLP. Like it wasn't how he explained it. It was I thought something like I was having a heart attack with high blood pressure. I don't know, like things were going through my brain. So my husband gets on the phone with my OB, and he's like, well, he's like, just go to the ER, just check it out. So he drives down, and like we probably got to the hospital. We live in the mountains, so it's 15 minutes to town, and like it hurt so bad. Like I was in fetal position in the car. Every little bump, I was like, oh my gosh, like I couldn't breathe. I don't even know how to explain the pain. I don't want anybody else to have to experience it because it was horrible. So we went into the emergency room, and the ER doctor, like my husband's like, she's having chest pain, so of course they slap on like all these EKGs and testing my heart and everything. And I mean, I had needles in my arm before I was even on the table. But what the most frustrating thing is, well, there's a lot of frustrating things in this story, but the ER doctor has a 29-week pregnant woman on her table complaining of like chest pains. You would think that she would know about HELLP syndrome, and she'd be like, is there a HELLP syndrome going on here? Oh no, my husband was like, they thought I was having a heart attack. I don't know. And he wasn't like, she's having a heart attack. No. I was in like the worst pain. I don't even know. I mean, I was like curled in a ball. I couldn't even open my eyes. I had to just focus on breathing. The whole time they had a monitor on the baby, and he was fine. He wasn't distressed or anything. Um, so my husband's like, well, the doctor told us to watch for like liver pain because of HELLP syndrome. And she's like, oh. So they call my OB, and so apparently we go upstairs to the labor and delivery room, and um, he checks me out, and the doctor pretty much said that he would not operate. He wouldn't do a C-section on me. He knew it was HELLP syndrome, and he told my husband that I was the worst patient that he has ever seen, and that he would not feel comfortable trying to deliver me in case there was any more complications. So this whole time they were testing my platelet level, and it was fine. It was dropping a little bit, but it was still good. So they flight lifed me to a university hospital in Denver, and it was a 9-minute flight. My husband, bless his soul, he was unable to go with me. The only thing I remember about the flight was that my feet were like hitting a wall. Like they were all like crunched up, and like I was annoyed because my feet were like getting squished. I guess it was like a 9-minute flight. My husband and my parents actually came down. Little did I know, I literally thought that we were at the emergency room for half an hour. We were there for like 5 hours. and I have no recollection of like more than